Psychetruth. Life, wisdom.
Hey everybody, welcome back. This is Dr. Echols, and we're very fortunate today to have Joy with us. And today we're going to look at her lower back area. She told me that she had been having she's a yoga instructor and also like a gymnastics teacher. Is that right?
Yes.
So, my son used to do gymnastics, so I know kind of what's involved with that, and it can be quite a workout for the old body. Yeah?
Yeah.
Yeah, exactly. So she's been doing some back bends and was telling me that her back has been kind of bothering her a little bit. So we kind of wanted to look at that today and just see if there's some things that we could do to help, maybe quieten some things down, maybe make things function a little bit better and that kind of thing. So we'll start off, Joy, why don't you just tell me a little bit about what some of the symptoms you are you're experiencing there?
I just get a little bit of pain or tightness after I do a lot of back bends. It's just a little sore afterwards.
Okay.
I'll get the occasional kind of pinched nerve feeling in the hip, but
okay. And when you say that, does it go down into the legs or does it stay right in the buttocks area? Or
it has in the past, like a few years ago, it would radiate down. But I've really tried to focus on it. So now if it happens, it just happens for a little bit and it stays in the one area.
Okay.
It doesn't travel.
And when it went down there before, did it go all the way to the feet or was it just like the knees or?
Kind of just would go to the knee.
Knees,
Kind of
okay.
like I'd kind of collapse out of walking, because it wouldn't be able to
Hold it.
Exactly.
I got you. And these are important questions to ask. The doctor wants to know these things because oftentimes when you get pain, it radiates all the way down into the feet and there's numbness or pain going down there. Oftentimes that person has injured the disc, which is the little cartilage separator from the bones. And if that is bulging back, it can hit the nerve. And oftentimes we'll see that pain travel all the way down into the leg. And that's a horse of a different color. It doesn't look like that's what we're dealing with here today. So we'll just do a few checks and see what we can do to maybe find out where this problem is originating. It could be in the muscles themselves. It could be in the pelvic structure, the sacrum or the ilium bones that attach to it. Or it actually could be in the spinal bones themselves. So today we'll do a little bit of figuring out where it's actually coming from. Does that sound good?
Yes, sir.
Okay. Okay, I think the first thing we'll do now is I'm going to have you lay on your back for me here.
And I guess I forgot to mention, I kind of feel like a block happening if I'm in a straddle and then pulling forward, like I'll feel like it just stops. It won't give. It feels like a block is happening.
So are you talking about with your legs coming out like that, they just stop?
Yeah, so if I'm, do you mind if I?
No, show me.
So if I'm in a straddle and reaching forward, I just kind of feel these blocks happening in my body that
Gotcha.
makes it feel like I can't go any further.
Yep, so she's saying that something's stopping her from going any further than she would like to go. Okay? So, now normally what I would do when I have this kind of a situation, I pretty much know that this is not a disc problem. But just to show you what this looks like, I would want to do what we call a straight leg raise. This kind of rules out the fact if it is a disc problem or not. And we just kind of going to gently raise this leg up like this. Are you having any back pain here?
No.
So if we only make it to this far and she's getting like a lot of pain in her back, or it could be even up here, that can be an indication that she has a herniated disc in her lower back. This is called a straight leg raise. But from her symptoms, we kind of figured out that probably wasn't what was going on. But just to make sure and do our due diligence, there's no pain there and there's no pain here. Right? Exactly. And we didn't really expect that would be. So the next thing we want to do, we just kind of want to palpate here on this is the psoas muscle that comes through here. And I'm just going to gently kind of poke around in here and ask if there's any pain in there.
Felt a little bit of a...
Okay, so the psoas muscle is a huge muscle that attaches in the lower back, comes kind of through the pelvis and attaches down here onto the leg bone. It's what's responsible for bending you over and also for flexing your hip up like this. And what about over on this side? About right here?
Yeah.
Tender there, isn't it? Yeah. So this psoas muscle feels
That one's,
not as bad. This one is a little bit more. Okay. So the way we check this muscle, and by the way, this is a very strong muscle. It has to be, because it's holding you up and allowing you to bend over. So this muscle, I should not be able to push this muscle. It should be very strong. So the way we test this is we're going to externally rotate the foot out like this. And you want to watch this hip bone. If this hip bone raises way up off the ground, this muscle's probably weak because she's recruiting other muscles to help hold this up. But hers is staying pretty flat. So we're going to push here and hold this bone down. And then, Joy, I'm going to have you push your legs straight up this way. Push up for me. And that muscle's locking pretty good. That's what we're looking for. You're not pushing real hard because you can overpower them. We're just making sure that that muscle does in fact lock there. And then we're going to do this from this side of the table. I'm going to have you push here for me. And that muscle is actually working fairly well too. So both psoas muscles in this case are actually functioning. There's not a real problem with that. So we can move on to another couple of muscles. And I'm going to move down here. And these muscles that run along the side of the legs here, this is called the tensor fasciolata muscle. Some people call it the iliotibial band that runs through there. So we want to check this one. And the way we do this is we internally rotate the foot. We're going to have you push out this way. Go ahead and push out. Ah, so that one doesn't work. I think I saw that on your face. You know, when we got her in this position, she's looking apprehensive. She already knows this isn't working. So when you try to push this out, it doesn't work. Okay, and I'm barely pushing at all. It's almost the weight of my arm can just push her arm down. And she's obviously fit. She's a strong young lady. She should be able to resist that. And you know, we could have Arnold Schwarzenegger on the table. And if that muscle was not working properly, I could easily push his muscle in. This has nothing to do with about fitness, and people do get confused about this because they'll say, "Yeah, I need to exercise my legs more." Nothing to do with that. If this is turned off, it's turned off neurologically, just like a circuit breaker. If it trips, it's going to shut the refrigerator off. If something trips a circuit breaker in her body, this muscle is going to turn off no matter how fit or conditioned it is. It's not going to work. And that's the case with her. So let's try the other one, okay? Push out here. And this one works fine. Feel the difference. Mm-hmm. I can really push pretty hard on that one, and it's not going to work. With this one, I can use one finger, and it's just, she can barely hold her leg up that way herself. It just barely will even work. So there's obviously, you know, this leg isn't way out of condition. This one's in great condition. It doesn't have anything to do with that. It's neurologically disconnected. Now, this is important because the fact that muscle doesn't work, what else might not be working because of that neurological disconnection? Mm-hmm. So there's a couple more muscles that we want to check that have to do with the lower back. And this one is this main muscle right here. It's called the rectus femoris. And you're going to push your leg up for me, and no, nothing there, right? There's just nothing there. One finger. See that? I had one finger going right down. Very fit lady. Push this one up for me. I cannot push it down. I am pushing hard. I cannot push it down. So this is wonderful because we get to really see the disparity here in what happens. Now, is this lady going to be able to function and do all of the things that she wants her body to do when these muscles won't even turn on? The answer is obvious. Of course not. So our job, and we've already done part of it, is to locate these muscles and then figure out how to turn them back on so that they can work. Okay, so we've done that. Let's check a few of the muscles in the lower back themselves and see how that works. And the way we're going to do that, Joy, is I'm going to bring your feet over here, and we're going to hold your hips here. Mm-hmm. And I don't want you to let me pull your legs this way. Okay. Okay? This is checking. That table moves. This checks the quadratus lumborum muscle. We're going to turn your foot out like this. Don't let me pull your legs this way. That checks the iliocostalis, and this is the multifidus. Pull here for me. And that one's okay. Now bring your legs over this way. Now don't let me push your legs this way. Good. Turn this foot out. And in. Just like that. And the muscles of the lower back, these ones that actually radiate down through here and on our back, they're actually checking out fairly good. So oftentimes when these leg muscles working or not working like hers, we know that we have a problem in either the pelvis or in the lower back. So let's investigate that a little bit further. Now, I use this muscle, and this was what we call a group muscle, and because it's several muscles working together, whereas before I was just testing one muscle. Here we're going to use a group muscle, which is your whole shoulder muscles. I want you to push this way back. Okay, and that muscle's real nice and strong. And I'm going to have you, let's see, I think the first thing we'll do is this rectus. I'm going to have you put your hand, this is where that weak muscle was. Mm-hmm. So you're going to put that hand right there, and that normally, push now for me, that makes a strong group indicator, makes it weak, because now she's touching this. So we've got a weak muscle there. And so we're going to check that we know that this muscle is not working properly. Push. Let me see. Push here for me. Okay. There we go. All right. So part of the trouble with hers is we've got these acupuncture points. There's other names for these points. And one for this muscle is right here. And it's going to be right here. And that's going to be pretty tender. Ooh, that's pretty goosey for her. So we're going to just hold that for a minute and feel for the pulsing. And we're going to synchronize these pulses here in this area. And we could just throw her on the table and adjust her, but sometimes that might fix it, but oftentimes it doesn't, or it just keeps coming back over and over again. So by taking a little extra time and doing this, we can actually correct this and fix it so that it doesn't keep coming back every week. Mm-hmm. And oftentimes the person will tell you that it's really goosey or really tender there, but by the time I start feeling the pulses, they will normally report to me that it's not so tender anymore. Right on it.
Definitely was not as bad as the first time.
Yes, it gets better, doesn't it? Push right here for me. Okay, put your hand right here now. Let's see here. Okay. Now that might have been enough to fix that muscle already. I don't know till I really go down here and check it out. Okay? But just hitting those points is oftentimes enough, just like resetting a circuit breaker. Mm-hmm. So, push up for me real hard. And in this case, it wasn't enough. So we're going to have to do a little bit more work on this to get it to work properly. I want you to hold right here again. Let's see. Okay. All right. Now, let's have you push up for me now. Okay. So the body's telling me that she has a misaligned vertebra in the spine that's contributing to this problem. So we're going to go look for that. You can take this off, push here, Push. Okay, and the problem in this case is her sacrum. You know what your sacrum is?
Yes.
Yeah, it's that big bone that's kind of in the back and your hip bones that kind of attached to it there. So we're going to get set up and I'll show you exactly how we would adjust this in my office. Okay, so we've got Joy on the table. This is what we call side posture here. And the anatomy here, this is where her sacrum is. Her last vertebra is right here. Her sacrum is what attaches there, and the sacrum goes down like this, and then it goes right down there onto the base of her tailbone. So this tested that her sacrum was rocked backwards on this side, and that was one of the things that was shutting off that muscle and causing some problems. So we're going to adjust it forward this way. Just let me have your hip right there, just like that. That a girl. All right, now go ahead and lay back on your back. And I'm going to just tap that real quick. And let's do this. Push here. Good. Okay. Put your hand right back here for me like this. Push now. Okay, so now let's go back and check the muscle now and see how it's doing. Push up for me right here. Push up real hard. Look at there. Remember the one finger thing? I've got my whole hand on.
Like I actually can.
You can actually.
Resistance.
Yes.
Whereas before it was just like.
No, there wasn't anything there.
They're non-responsive.
Non-responsive. So that was definitely affecting her ability to function, especially since she's into, you know, the healing arts and yoga and different things like that. It was definitely adversely affecting her ability to function properly, even though she might not have really known what the problem was. But having her sacrum out of position, and we determined that her sacrum was out of position by doing the muscle testing. The body actually, you ask the question, the body will actually tell you where the problem is. Pretty smart body. A lot smarter than me. And we can find out and then we can make that correction. So that's working now. Now, we don't know whether we fixed the other muscle that was weak, but we can go back and check it. Push.
Oh, wow.
Now that one's working too. So that's what we call a 2-for-1er. 2-for-1er. That's right. Push out here. That's right. Push up here for me. Good. And push up right here. So it's all working perfectly there. If we get her up in a minute and she'll be walking around, she'll probably think that probably feels a lot better and she's working. So a lot of times people will have lower back problems that don't involve being a disc like hers were. And in this case, it was that her pelvis was out of position. And we might want to follow up with her later to make sure that we've got this pelvis square and correct. And then once we've done that, we would want to go to each individual vertebral level and make sure that those are corrected too. When you have a pelvis that's square and a spine that's straight, it's going to last so much better than one that's all twisted and turned, because it's like driving the car with the tire out of alignment. Even though it may not be pulling drastically, if it's pulling at all, it's going to start wearing that tire out. Very similar in the spine. If you've got distortions all in the pelvis and the spine, it's going to cause arthritic changes, degeneration, decay to start taking place in that spine. And a lot of that can be prevented with just good old chiropractic care. I hope this has been of help to you. If you're suffering from these problems, find a doctor of chiropractic that can help you with this, similar to what I'm doing here. If we can be of any assistance to you, please don't hesitate to contact me. www.jeffechols.com. I'll be glad to help however I can. We'll see you on the next video.